What do you understand to be the primary roles and responsibilities of a healthcare assistant?
A healthcare assistant supports patients with personal care, safety, comfort, and daily living, while also helping the clinical team deliver effective treatment. At its core, the role is about dignity, empathy, and consistency. In my view, the responsibilities fall into three main areas: direct patient care, communication, and teamwork. Direct patient care involves helping individuals with everyday tasks such as washing, dressing, eating, mobility, and toileting. It also includes monitoring observations like temperature, pulse, respiration, and blood pressure as directed by a nurse. I see this as more than routine. It is often the moment when patients feel most vulnerable, so maintaining privacy, respect, and reassurance matters as much as accuracy. Communication is another key responsibility. A healthcare assistant must notice changes in a patient's physical or emotional state and report them promptly. Clear communication prevents small issues from becoming serious. For example, during one shift in my previous role, a patient became unusually withdrawn and refused breakfast. I recognized this was out of character. I alerted the nurse in charge, who arranged a review. It turned out the patient was developing an infection. Early action meant they received treatment quickly, and their condition stabilized within a day. Teamwork ties everything together. HCAs work alongside nurses, doctors, therapists, porters, and cleaners. Understanding your role within the wider system helps the unit run safely. I have often stepped in to support colleagues when a ward is under pressure, whether by helping with admissions or ensuring rooms are prepared for new arrivals. This keeps patient flow steady and reduces stress on the team. Overall, a healthcare assistant ensures patients receive compassionate, safe, and consistent care while acting as a reliable support to the clinical team.
How do you maintain patient confidentiality?
Maintaining patient confidentiality is one of the most important responsibilities in healthcare. I treat it as a daily practice rather than a rule that sits on paper. For me, confidentiality means protecting information in every format, whether spoken, written, or digital, and making sure trust is never broken. In my previous role, I worked on a rehabilitation ward where staff handled sensitive information every shift. One example that illustrates my approach happened during a busy morning when a patient's relative approached me at the desk asking for details about the patient's recent diagnosis. The relative sounded worried, and it would have been easy to answer quickly to ease their concern. Instead, I followed protocol. I explained politely that I could not share clinical information without the patient's consent and suggested they speak with the nurse in charge after the patient confirmed who could be updated. I then went to the patient directly, explained the request, and asked whether they wanted information shared. The patient said yes, but only a summary. After confirming this with a nurse, the conversation was handled properly. The relative appreciated the clarity, and the patient later said they felt respected and in control. Behind the scenes, confidentiality also means controlling access. I never leave notes visible on desks, always log out of computers as soon as I step away, and avoid discussing patients in hallways, lifts, or communal areas. If I see colleagues chatting in a way that might risk privacy, I redirect the conversation to a private space. I also follow data protection training closely and stay updated on policies because confident knowledge helps prevent mistakes. Overall, I protect patient confidentiality by combining respect, communication, and strict adherence to protocol. This builds trust, keeps care safe, and ensures every patient feels secure.
What steps do you take to prevent cross-contamination and maintain infection control?
Infection control is something I approach with discipline, consistency, and awareness. Good practice protects patients, colleagues, and myself, and it keeps a care environment safe even during busy or pressured moments. I see it as a combination of routine habits and conscious decision-making. A clear example of this came during my time on a short-stay medical unit. We had a sudden increase in patients with respiratory infections, and the risk of cross-contamination rose sharply. My responsibility was to support the nursing team while making sure every action met infection control standards. The first step I always take is rigorous hand hygiene. I'll wash or sanitize my hands before and after every patient interaction, after touching any surface that could be contaminated, and during tasks that require a clean to dirty sequence. In a situation on the unit, This meant sanitizing dozens of times per hour, even when moving quickly between bays. I never cut corners because small lapses can cause big problems. The second step is correct use of PPE. When working with patients who were coughing or producing secretions, I ensured masks, gloves, and aprons were worn and disposed of immediately after leaving the room. My task was not only to use PPE properly, but also to support others. I noticed one new staff member struggling to gown up under pressure, so I paused my task, helped them secure their mask, and reminded them about the correct removal technique. This small intervention prevented potential contamination, and the nurse later thanked me for stepping in. Environmental hygiene is equally important. I disinfect equipment like hoists, blood pressure cuffs, and commodes before and after each use. During the busy week on the unit, I set aside a few minutes each hour to check that high-touch areas were wiped down, which helped reduce microbial spread. The result was clear. Our unit avoided secondary infections, staff sickness stayed low, and the matron commended the team for maintaining strict infection control practice during a high-risk period. I maintain these habits every day because infection control is not about one moment of caution, but about steady, reliable behavior.
What are the signs and symptoms of a pressure ulcer bed sore, and how would you prevent one?
Pressure ulcers develop when skin and underlying tissue are damaged due to prolonged pressure, friction, or shear. The early signs are often subtle, so I focus on noticing changes before they progress. Common symptoms include redness that does not fade after pressure is relieved, warmth, hardness, swelling, or skin that looks shiny or feels different from surrounding areas. On darker skin tones, the area may appear purple, blue, or slightly ashen rather than red. As an ulcer worsens, the skin may blister, open, or form a crater. Pain is another key sign. Many patients describe discomfort even before the skin breaks down, which makes listening just as important as observing. A clear example of how I prevent pressure ulcers comes from my work on an orthopedic ward, where immobility was a constant risk. One patient had reduced mobility after a hip operation and spent long periods in one position because movement caused pain. The task was to prevent skin breakdown during their recovery, which was expected to take several days of restricted mobility. My first action was completing a skin inspection at the start of every shift, focusing on heels, elbows, sacrum, and shoulder blades. I used a turning chart and collaborated with a nurse to reposition the patient every 2 hours. Because the patient struggled with discomfort, I supported them by explaining each movement beforehand, using pillows to offload pressure, and encouraging small shifts they could manage independently. I also checked their mattress setting, ensuring it was correctly inflated for weight redistribution. Hydration and nutrition were monitored, since both influence skin integrity. I communicated any redness or changes immediately, so the nurse could review and document them. The result was that the patient did not develop any pressure damage throughout their stay. At discharge, the physiotherapist noted that consistent repositioning helped maintain their skin health and supported their rehabilitation. This experience strengthened my commitment to early detection, regular repositioning, and clear communication because effective prevention comes from teamwork and constant vigilance.
A patient refuses their care. How do you handle the situation?
When a patient refuses care, I start by protecting their dignity and their right to make choices. I never push or argue. Instead, I focus on understanding what is driving the refusal and finding a solution that keeps the patient safe while respecting their autonomy. A strong example comes from my time on a rehabilitation ward. One patient recovering from a stroke refused personal hygiene one morning. The situation was delicate because he relied on staff for most daily tasks and had already developed mild redness on his lower back. The task was to support him while preventing any risk to his health. My first action was to step away from the busy environment and sit at eye level. I asked open questions to understand how he felt. He explained he was frustrated and embarrassed about needing help. I acknowledged his feelings and reassured him that maintaining independence did not mean doing everything alone. Once he felt heard, I explained why personal care mattered that day, especially the risk of skin breakdown if we skipped hygiene and repositioning. Even with this, he still hesitated. To reduce the pressure he felt, I offered options. I asked whether he preferred a male staff member or whether he wanted to do part of the wash himself while I supported only where needed. He chose to complete the upper body himself and asked for help with the rest. I prepared warm water and ensured privacy by closing curtains and placing towels carefully. I kept conversation light to reduce embarrassment. After the wash, I checked his skin, applied cream to the at-risk areas, and recorded the interaction. I later informed the nurse, who arranged emotional support from the occupational therapist. The result was that the patient accepted care without feeling forced, and over the next week, he became more cooperative because he felt in control. This experience showed me that patience, empathy, and clear communication can turn refusal into cooperation while keeping the patient safe.
Describe a time you noticed a significant change in a patient's condition, e.g., sudden confusion, difficulty breathing. What did you do?
During a late shift on a medical ward, I cared for an elderly patient who had been stable throughout the day. She had mild pneumonia but was alert, eating well, and interacting normally. About 2 hours into my shift, I noticed she seemed unusually quiet. When I approached her, she appeared confused, was slow to respond, and her breathing looked more labored. This was a clear change from her baseline, so I moved quickly while staying calm. My task was to assess what I could within my scope and escalate the concern without delay. I checked her vital signs straight away. Her respiratory rate had risen sharply, her oxygen saturation had dropped by several points, and she was slightly clammy. I also checked her orientation by asking simple questions. Her responses confirmed her confusion was new. I pressed the call bell and informed the nurse in charge, giving a clear handover. What her baseline had been earlier, what I observed, her current vital signs, and the timeline of change. While the nurse prepared oxygen therapy and contacted the doctor, my action was to stay with the patient, reassure her, and keep her upright to ease her breathing. I also cleared the space around her bed so equipment could be brought in quickly. When the doctor arrived, they suspected worsening infection and possible sepsis. Blood tests were ordered, antibiotics were adjusted, and she was moved to a higher acuity bay for closer monitoring. The result was that she stabilized within a few hours and avoided ICU transfer. The doctor later said early recognition made a real difference. That moment reinforced the importance of knowing a patient's baseline, paying attention to subtle changes, and escalating issues immediately. It is routine observation skills that protect patients in critical moments, and I carry that discipline into every shift.
How would you safely transfer a non-ambulatory patient from the bed to a wheelchair?
Safely transferring a non-ambulatory patient starts with planning, communication, and strict adherence to manual handling guidelines. I never rush this task because most transfer incidents happen when staff try to save a few seconds instead of preparing properly. A clear example comes from my work on a neurological ward, where I often supported patients with severe mobility limitations. One patient with advanced multiple sclerosis needed help moving from bed to wheelchair for physiotherapy sessions. The transfer required accuracy because she had poor trunk control and was at high risk of sliding or sudden spasms. The situation began with a full risk assessment. I checked her notes, mobility plan, and the handling chart to confirm the required equipment, which in her case was a full-body hoist. My task was to complete the transfer smoothly while preventing strain on her body and avoiding injury to either of us. My first action was preparation. I cleared the floor of obstacles, ensured the wheelchair brakes were locked, footrests removed, and the cushion correctly placed. I explained every step to the patient at a calm pace, even though she was non-ambulatory, because communication helps reduce anxiety and sudden movements. After washing my hands, I positioned the hoist and selected the correct sling size. I checked the sling for fraying and made sure all loops were attached to the spreader bar at equal lengths. Once she was lifted, I guided the hoist slowly, keeping her centered to avoid sway. I lowered her gently into the wheelchair, ensured she was fully upright, adjusted her hips, and replaced the footrests. After the transfer, I checked her comfort, secured the lap belt, and documented the procedure. The result was a safe transfer with no distress. The physiotherapist later commented that the preparation helped the session start smoothly. This experience reinforced my approach. Assess the patient, use the right equipment, communicate clearly, and never skip safety checks.
Tell me about a stressful situation you encountered at work and how you managed it.
One of the most stressful situations I faced happened during an extremely busy evening on a short-stay medical unit. We had several unplanned admissions arrive within an hour, and two staff members were off sick. The ward atmosphere shifted quickly. Phones were ringing, buzzers kept going off, and patients were becoming anxious because they sensed the pressure around them. My task was to stay calm, prioritize safely, and support both patients and colleagues without letting the situation spiral. The moment that tested me most was when a new patient with uncontrolled diabetes became nauseous and dizzy at the same time another patient with dementia tried to wander off the ward. I was the closest staff member to both situations. I knew I could not be in two places at once, so I had to act decisively. My action began with safety triage. I guided the unwell diabetic patient onto the bed, checked their airway and breathing, and pressed the emergency call bell so the nurse in charge could respond immediately. Once the nurse arrived and took over, I redirected myself to the wandering patient. I approached calmly, used a gentle tone, and reminded him where he was and why it was important to stay in a safe area. I guided him back to his bay and engaged him in a simple conversation to reduce agitation. After both situations were stabilized, I took a minute to update documentation, restock the equipment trolley, and check in with the rest of the team. The result was that both patients remained safe, and the nurse later thanked me for keeping control during a difficult moment. By prioritizing clearly, communicating openly, and staying composed, I helped the team manage a high-pressure shift without compromising patient care. This experience strengthened my ability to stay steady, think fast, and act with purpose when stress levels rise.
Why do you want to work as a healthcare assistant, and what qualities do you possess that make you suitable for this role?
I want to work as a healthcare assistant because I believe meaningful care starts with the small, consistent actions that make a patient's day safer and more manageable. I enjoy direct contact with patients, and I find purpose in supporting people through some of their most vulnerable moments. The role allows me to combine compassion with practical skill, and it gives me a chance to contribute to a team that improves someone's quality of life every single shift. What makes me suitable are the qualities I have built through real experience. I am patient, steady under pressure, and attentive to detail. In my previous role on a medical ward, I learned how much difference it makes when an HCA truly pays attention. For example, one morning a patient recovering from abdominal surgery told me her pain felt different. It was not an obvious emergency, but I listened closely and asked the nurse to reassess her. The change turned out to be the start of a small internal bleed. Early intervention prevented a much more serious outcome. That moment shaped my understanding of the role. It showed me that being observant and taking concerns seriously can protect a patient long before something becomes critical. I also bring strong communication skills. Patients need clear explanations, especially when they feel overwhelmed or frightened. I make sure to speak calmly, involve them in their care, and check that they understand what is happening. Colleagues rely on accurate handovers and honest updates, and I take that responsibility seriously. Finally, I enjoy teamwork. A ward runs well when every person understands their role and supports others. I step in where needed, keep tasks organized, and maintain a positive attitude even during demanding shifts. These qualities help me deliver safe, respectful care, and they are the reason I am committed to the HCA role.
Describe your approach to communicating with patients who have communication barriers, e.g., hearing impairment, dementia, language difference.
My approach to communicating with patients who have communication barriers is based on patience, clarity, and adaptation. I never assume one method will work for every individual. Instead, I adjust my style until I find what helps that patient feel understood and safe. A strong example comes from my time on a mixed medical ward. I was caring for an older gentleman with dementia who became anxious whenever staff approached him. The situation was challenging because he also had hearing impairment, so his confusion intensified during routine tasks like washing or taking observations. My task was to communicate in a way that reduced distress and helped him accept care without feeling overwhelmed. My first action was to slow everything down. I approached from the front, maintained eye contact, and used short, simple sentences. I avoided rapid movements because he reacted strongly to anything he perceived as rushed. To support his hearing needs, I spoke clearly but did not raise my voice, and I made sure my face was visible so he could read my expressions. When he struggled to understand, I used gestures, pointed to objects, or demonstrated the action. For example, before taking his temperature, I held up the thermometer and mimed placing it near his ear. He responded well to these visual cues. I also learned key information from his daughter, who visited regularly. She told me he enjoyed football and responded positively when people mentioned his favorite team. I used this during care, starting conversations with topics he recognized. This helped gain his trust and lowered his anxiety. The result was noticeable. Over the next few days, he accepted personal care more easily, resisted less, and even initiated small conversations. The nurse in charge later commented that the personalized communication approach helped stabilize his behavior. This experience reinforced my belief that good communication is not one technique, but a willingness to adapt, observe, and meet patients where they are.
How do you manage the emotional aspects of caring for terminally ill or distressed patients?
Caring for terminally ill or distressed patients requires emotional strength, clear boundaries, and genuine compassion. I approach it by being present for the patient while also protecting my own well-being so that I can keep giving safe, consistent care. A moment that shaped my approach happened on a palliative ward where I supported a woman in the final stage of heart failure. She often became breathless and frightened at night, and her family could not stay. The situation was emotionally heavy for everyone involved. My task was to provide comfort without making promises I could not keep, and to stay steady even when she expressed fear about dying. My first action was to focus on calm reassurance. When she became distressed, I sat beside her, held her hand if she wanted it, and spoke slowly so she could follow my words. I reminded her she was not alone and that we would manage her symptoms together. While the nurse prepared medication, I helped her adjust her position, supported her breathing with a raised bed, and guided her through simple relaxation techniques. This eased her panic until treatment took effect. Emotionally, the challenge was not absorbing her fear. After each episode, I took a moment to breathe, documented the interaction clearly, and shared how the patient was coping with the nurse in charge. I made a point of speaking with colleagues after difficult shifts. Open conversations prevented the pressure from building up and helped us support each other as a team. Outside of work, I use grounding habits like walking or journaling to release tension before my next shift. The result was that the patient felt safe during her final weeks. She told me once that the calm tone of the night staff helped her rest. For me, it reinforced the importance of empathy balanced with self-care. Being emotionally strong is not about shutting down feelings. It is about acknowledging them, processing them, and staying committed to giving patients dignity, comfort, and human connection when they need it most.
Give an example of a time you worked effectively as part of a team.
A strong example of effective teamwork happened during a winter surge on a medical admissions unit. We were operating at full capacity, and the pressure was high because ambulances were arriving faster than beds could be prepared. The situation demanded tight coordination, clear communication, and a shared understanding of priorities. My task was to support the team in maintaining safe patient flow while ensuring no one's care was rushed. At one point, we had 3 new admissions waiting, 2 discharges delayed, and a confused patient trying repeatedly to leave his bay. The nurse in charge called a brief huddle to assign roles. I volunteered to handle bed preparation and assist with assessments because I knew that speeding up turnovers would relieve the backlog. My first action was to coordinate with the porter and the domestic team. I prepared 2 rooms in under 15 minutes by organizing equipment in advance, disinfecting high-touch areas, making beds quickly but neatly, and checking all safety items like oxygen supply and call bells. While doing this, I stayed in radio contact with the nurse so the moment a bed was ready, the admission process could start. When a confused patient grew agitated, another HCA asked for support. We worked together, using simple explanations and a calm tone to guide him back to his bay. While she engaged him in conversation, I removed environmental triggers like noisy equipment and ensured he had his hearing aids inserted. This prevented an escalation and allowed the nurse to continue triaging new arrivals. The result was a smooth transition of multiple admissions within a short window. The nurse later said our teamwork prevented a bottleneck that could have compromised safety. That shift confirmed how communication, shared responsibility, and willingness to help beyond assigned tasks make a team function well. I carry those principles into every ward I work on.
You are assisting a patient who is being verbally abusive towards you. How do you respond while maintaining professionalism?
When a patient becomes verbally abusive, I remind myself that my job is to stay calm, protect safety, and keep the situation controlled. I never take the words personally, even when they are harsh, because distress, pain, or confusion often drive that behavior. My focus is on de-escalation and protecting the patient's dignity without allowing abuse to continue. A clear example happened on a medical ward when I was assisting a patient with severe alcohol withdrawal. He became agitated during personal care and started shouting insults, accusing staff of harming him. The situation was tense because the ward was busy and other patients were becoming unsettled. My task was to provide essential care while preventing the situation from escalating into physical aggression. My first action was to lower my tone and give him space. I took one small step back, kept my body language open, and said his name so he could focus. I told him calmly that I was there to help, but I could only continue if he spoke to me safely. I avoided arguing or correcting every accusation because that would have added fuel to the moment. Instead, I acknowledged his fear by saying, "I can see you're upset. Let's slow down so we can sort this together." When his agitation increased, I paused the care task and prioritized safety. I pressed the call bell discreetly so another staff member could stand by. With support present, I offered him options, such as taking a short break or having a different staff member come in. Giving choices helped him feel some control. He agreed to continue with another HCA, and I handed over smoothly. Afterwards, I documented the incident, informed the nurse in charge, and ensured the patient was medically reviewed for withdrawal escalation. The result was that the situation ended without harm, and the patient later apologized when he was clearer. That experience reinforced my approach: stay composed, set safe boundaries, involve colleagues early, and focus on the patient's underlying distress rather than the hostility.
Describe a time when you disagreed with a colleague or nurse about patient care. How did you resolve the conflict?
In my previous role as a healthcare assistant on a busy medical ward, there was a situation where a nurse and I disagreed on the timing of administering a patient's mobility exercises. The patient had recently undergone hip replacement surgery and was experiencing significant pain. I was concerned that proceeding with the exercises immediately after their morning medication would cause discomfort, while the nurse felt it was important to maintain the scheduled physiotherapy plan. Recognizing the potential impact on patient safety and comfort, I calmly voiced my concerns, providing specific observations about the patient's pain levels and limited range of motion that morning. I suggested that we review the patient's latest physiotherapy notes and pain assessment charts before deciding. This approach allowed us to focus on evidence rather than personal opinions. Together, we agreed to consult the physiotherapist and the patient's care plan, which recommended slight modifications to the timing of exercises based on pain levels. We decided to delay the session by an hour, giving the patient additional pain relief and allowing for a gentler approach. I assisted in monitoring the patient's response, documenting changes, and providing updates to the nurse. As a result, the patient tolerated the exercises well, reporting less discomfort and demonstrating improved engagement during rehabilitation. The nurse appreciated the evidence-based approach, and we both reflected on the experience as a reminder of the importance of open communication, collaboration, and patient-centered care. This situation reinforced my ability to advocate for patients respectfully, resolve disagreements constructively, and maintain a professional working relationship, even under pressure.
How do you handle the emotional demand of assisting patients with long-term or debilitating illnesses?
Working as a healthcare assistant on a chronic care ward, I often cared for patients with long-term conditions such as advanced COPD or Parkinson's disease. One particular situation involved a patient who had been hospitalized repeatedly due to severe respiratory issues. I noticed the patient became increasingly withdrawn and anxious during their stays, which made routine care, such as assisting with personal hygiene and mobility, emotionally challenging. I recognized that managing my own emotional response was critical to providing consistent, compassionate care. I focused on developing a structured approach. I began by actively listening to the patient, acknowledging their fears and frustrations without judgment. I also communicated openly with a multidisciplinary team to ensure care strategies aligned with the patient's preferences, which helped me feel supported rather than overwhelmed. To cope with the emotional demand, I implemented reflective practices at the end of each shift, noting situations that affected me and discussing them with senior staff during handovers. I also made use of short mindfulness techniques between tasks to maintain focus and emotional balance. As a result, the patient became more engaged in their care plan, showing improved cooperation during physiotherapy and personal care routines. My ability to manage my own emotions allowed me to remain patient and empathetic consistently, reducing stress for both the patient and myself. Over time, this approach strengthened my resilience and reinforced the importance of self-care and professional support networks in managing emotionally demanding roles. This experience has taught me that handling emotionally challenging situations in healthcare requires a combination of empathy, structured coping strategies, and professional support, all while keeping the patient's dignity and well-being at the forefront.
You have a shift with a heavy workload, and two patients require immediate assistance. One is asking for help in the bathroom, and the other is complaining of severe pain. How do you prioritize?
During a particularly busy shift on a general medical ward, I encountered a situation where I had to prioritize care for two patients simultaneously. One patient requested assistance to the bathroom, while another was reporting severe abdominal pain. Recognizing the urgency, I quickly assessed the situation using clinical judgment and my understanding of patient safety protocols. The task required me to ensure both patients' needs were addressed promptly without compromising care quality. I immediately acknowledged the patient in pain, reassuring them that help was on the way, and quickly alerted the nurse in charge about the situation to provide support. I then assisted the patient needing urgent pain assessment first, as unrelieved pain could indicate a potentially serious complication and required prompt evaluation and intervention. I closely monitored the patient's symptoms, noting the severity, and facilitated timely analgesia according to the nurse's instructions. Once the patient's condition was stable and pain relief had been initiated, I assisted the second patient to the bathroom, ensuring their safety and dignity. Throughout, I maintained clear communication, explaining each step to both patients to reduce anxiety and ensure they felt attended to. As a result, both patients received timely and appropriate care. The patient in severe pain felt reassured and had their discomfort managed effectively, while the other patient's needs were also safely met. This experience reinforced my ability to prioritize based on clinical urgency, maintain calm under pressure, and coordinate effectively with colleagues, ensuring patient safety and comfort even during high-pressure situations.
How do you ensure continuity of care when handing over a patient to the next shift or transferring them to another unit?
In my previous role on a busy medical surgical ward, I frequently handled handovers and patient transfers, understanding that effective communication is essential for continuity of care. One example involved transferring a patient recovering from a stroke to the rehabilitation unit. The patient had complex needs, including mobility limitations, dietary restrictions, and communication difficulties, which required careful coordination. Before the transfer, I reviewed the patient's care plan, recent observations, and any changes in their condition during my shift. I documented vital signs, mobility progress, and any issues with medication or nutrition, ensuring all information was accurate and up to date. During the handover, I provided a concise, structured report to the incoming healthcare assistant and nurse using the SBAR, situation, background, assessment, recommendation framework. I highlighted critical aspects such as the patient's risk of falls, communication needs, and response to therapy, emphasizing any interventions that required ongoing monitoring. Additionally, I accompanied the patient during the transfer, ensuring their safety and comfort, assisting with mobility aids, and explaining each step to reduce anxiety. Once settled in the new unit, I confirmed that the receiving team had understood all essential information and encouraged them to ask questions about the patient's needs. As a result, the patient's transition was smooth, and there were no gaps in care or missed interventions. The rehabilitation team was able to continue the care plan seamlessly, and the patient felt supported and reassured throughout. This experience reinforced my understanding that clear documentation, structured communication, and active involvement during transfers are critical for ensuring continuity of care and maintaining patient safety and dignity.
What steps do you take to help a patient maintain their dignity and independence during personal care, e.g., bathing or dressing?
In my role as a healthcare assistant, I have often supported patients with personal care while prioritizing their dignity and independence. One example involved an elderly patient recovering from a hip fracture who required assistance with bathing and dressing. The patient was initially reluctant to receive help, fearing a loss of autonomy. My task was to ensure the patient's hygiene needs were met without undermining their sense of independence. I began by explaining each step of the process, asking the patient which tasks they preferred to do themselves and which they needed help with. I encouraged them to perform tasks they were able to manage, such as washing their face or combing their hair, while I assisted with areas that were physically difficult or posed a risk of injury. I ensured the environment was private, using screens and closing doors, and maintained a respectful and calm demeanor throughout the care process. I also adjusted my approach based on the patient's mood and comfort level, frequently checking in to ask if they were comfortable and if they wanted me to pause. Using gentle guidance rather than taking over completely allowed the patient to feel empowered and respected. As a result, the patient not only received the necessary personal care safely, but also expressed satisfaction with retaining control over as many aspects of their routine as possible. This approach reinforced the importance of patient-centered care, showing that dignity and independence can be preserved even when full assistance is required. It strengthened my ability to balance safety with respect, ensuring patients feel valued and supported while meeting their care needs effectively.
What role does ongoing training and professional development play in your career as an HCA?
Ongoing training and professional development play a central role in my career as a healthcare assistant, both in maintaining high standards of patient care and in enhancing my own skills and confidence. Early in my career, I recognized that healthcare is constantly evolving, with new guidelines, technologies, and patient care strategies emerging regularly. For instance, I completed specialized training in manual handling, dementia care, and infection control, which directly impacted my ability to provide safe and effective care. In one example, after attending a workshop on recognizing early signs of patient deterioration, I was able to identify subtle changes in a patient recovering from pneumonia, which allowed the nurse to intervene promptly and prevent further complications. This experience highlighted how continuous learning directly benefits patient outcomes and safety. I also participate in regular reflective practice sessions and competency assessments, which help me identify areas for improvement and stay updated on best practices. Professional development also strengthens teamwork and communication. By attending courses in communication skills for patients with cognitive impairments, I was better equipped to collaborate with nurses and therapists, ensuring that patients' needs were met comprehensively. Furthermore, ongoing training keeps me motivated and engaged, reinforcing my commitment to providing compassionate, high-quality care. Overall, continuous learning enables me to adapt to complex and changing healthcare environments, maintain patient safety, and enhance the quality of care I deliver. It is not just a requirement, but a key part of being a competent, proactive, and professional healthcare assistant who contributes effectively to the multidisciplinary team and supports patients' well-being.
Where do you see yourself in 5 years?
In 5 years, I see myself as a highly skilled and confident healthcare assistant who has grown through experience, training, and steady responsibility. I want to be someone the team can rely on during complex situations, someone who understands the full rhythm of a ward and can support both new staff and senior nurses with the same level of commitment. I hope to have completed additional training such as venipuncture, ECGs, and enhanced observation skills. These competencies would allow me to contribute more during high-pressure moments and lighten the workload for the nursing team. I also aim to strengthen my knowledge in areas like dementia care, palliative support, and safeguarding, because these are the situations where patients need the calmest, most capable staff by their side. Experience has taught me that career growth in healthcare is built through consistency. In my previous roles, I always looked for ways to take on small challenges that helped me develop. For example, when a new HCA joined our ward last year, I noticed she felt overwhelmed by the pace of early morning care. I took the initiative to mentor her informally, guiding her through handovers, observation checks, and documentation flow. Over a few weeks, she became more confident, and the nurse in charge later told me that my support helped her settle into the team. Experiences like that made me realize I enjoy helping others grow, and I want to build on that skill. Long term, I can see myself progressing toward becoming a senior HCA or applying for nurse training. I do not see the role as a stepping stone, but as a foundation. I want to deepen my contribution year after year, stay grounded in patient care, and continue developing into someone who brings stability, skill, and compassion to every shift.